Hey doc, have you ever wondered how to explain in simple sixth grade language what's happening to somebody that's coming in to you with knee pain problems and why they might have had multiple shots or already had multiple surgeries and nothing seems to have improved it and made it better? And what are you going to do different? And how are you going to impact, their knee pain health and their function and their pain when all these other experts, these medical doctors haven't so far? Well, I usually like to use just, easy to understand visual demos. And so I'll kind of explain to a patient that if you think about your knee as one of the most simple joints in your entire body, it really just consists of two bones, the lower bone in your leg, the tibia, and the upper bone in your leg, the femur. And they're just designed to move and bend like this, like a simple hinge joint. And as long as that's doing that, you'll never have any problems. It doesn't matter whether you're 20 years old or 90 years old, you're gonna have good joint spacing, that knee's gonna function properly, and it's gonna be relatively pain-free. Now, also at any age, if you get that injured, and when you think about it, most of the injuries that people end up having surgeries for, whether that's a torn ligament, medial collateral ligament or lateral collateral ligament, or a meniscus, it's because the bones that those structures are, those tissues are attached to, have moved too far out of their natural position and cause that pulling and tearing and ripping. So if that knee gets misaligned, then instead of bending and moving like a hinge joint, and when it misaligns, now all of a sudden, every time you take a step, that joint is going to be twisting and grinding with every step. And that's what starts to lead to the degeneration and deterioration. So if somebody tells you, no, doc, you can't help me, I've got inflammation. Well, what is inflammation? It's just simply inflammation of a joint. And arthritis, if you know the Latin, itis means inflammation of. Arthrosis is just the Latin word for the joint. And so there's a reason, a cause. You don't treat the arthritis, you treat what's causing it. So if we can realign that bone and get it to function normally again, kind of like a car with its tires. If you drove over a curb and you threw off the alignment and you kept driving on that tire, sooner or later that tire is going to blow out, just like these people start having knee problems, whether it's immediately, if it's severe, or if it's slight, and it takes 10 years for their chronic debilitating knee pain to come about. Now, the problem is medically, they go in and they get shots, in that misaligned tire, or they'll get the tire replaced. And if you just replace the tire, with some kind of surgery, what's going to soon enough happen? You're just going to wear out that tire again. So the first thing you got to do is get that realigned, and then anything else you do is going to be far more effective. But that's a very simple visual way for your patients to understand what's going on with them and why all the things they have done up to this point, whether it's surgeries, shots, or therapy of some point, just hasn't helped or resolved their problem, so far up to this point. So I hope you use this tip, and we'll talk to you soon.